And now, I am pleased to invite our first researcher, Dr. Marc Lafrance in the Department of Sociology and Anthropology, to lead off our dance of desire.
Good evening. Recent statistics indicate that the number of elective surgical procedures undergone by Western men and women has increased significantly over the past 10 years. At once intriguing and alarming, this increase in cosmetic surgery has provoked a similar increase in media interest and attention. Indeed, from regular reports in major daily newspapers detailing the growing array of cosmetic surgical procedures, to infomercials extolling the virtues of quick and easy scalpel solutions, through to popular television programs such as Extreme Makeover, I Want a Famous Face, Nip Tuck, and The Swan, the post-millennial mainstream has become saturated with images depicting the ever more extreme lengths to which many are resorting in an attempt to create for themselves a perfect body. Yet what exactly is a perfect body in the modern West's post-millennial age? Many scholars argue that this body is first and foremost a perfectly sexed one. In other words, having a perfect body means having a perfect male body or a perfect female body. The demands now placed on the sex body are more formidable than ever before. Men's penises are expected to be thicker and longer, their stomachs harder, and their muscles bigger, while women's breasts are expected to be larger and firmer, their vaginas tighter, and their waists slimmer. Without the support of cosmetic surgical procedures and a range of other innovations in biomedicine and biotechnology, demands such as these would be, for the most part, impossible to meet. It would appear, then, that cosmetic surgical practices are becoming increasingly involved in the making and remaking of the body's sex. Indeed, cosmetic surgery is playing an ever more important role in what it means to have a male or a female body, and by extension, what it means to be a man or a woman. If this is true, then it could be argued that sex, like gender, is in some respects socially constructed. Or put slightly differently, that collective conceptions of masculinity and femininity are, by means of cosmetic surgery, coming to determine maleness and femaleness in ways more concrete than many might once have imagined. More specifically, if surgical procedures that not infrequently border on the reconstructive, are now felt to be required by many wishing to conform to present-day standards of manhood and womanhood, then it could be argued that the sex of the human body is, at the dawn of the post-millennium, increasingly man-made. Surgical technologies, be they cosmetic, reconstructive, or transplant-related, are proliferating at a rapid rate. Whether it is the emergence of new wrinkle removal procedures, the development of advanced techniques for growing and harvesting skin tissues, or the grafting of one face onto another, an increasingly impressive array of surgical technologies are being brought to bear on the human body. As scholars from across the disciplines make clear, these technologies have major implications. On the one hand, they have the potential to improve the lives of those who suffer from a wide variety of diseases, disorders, and disturbances. On the other hand, however, they have the potential to reshape our relationships to our bodies and our societies in ways we cannot predict or control. In brief, surgical technologies force both the individual and the collective to reflect on the stakes bound up in the body's parts and processes. To reflect, in other words, on who owns these parts and processes, on what they mean and why they matter, and on how they could and should be managed by those in the world of modern science and medicine. Now, given that my talk tonight relates more to cosmetic procedures than it does to reconstructive or transplant procedures, it is worth looking at a few statistics in order to get a sense of the present-day situation. Unfortunately, Canadian data are not available, so I will, with much chagrin throughout this presentation, draw on American data. Since the year 2000, the total number of cosmetic procedures in the United States is up by 63%. More specifically, breast implants are up 45%, breast lifts are up 75%, buttock lifts are up 162%, pectoral implants are up 62%, thigh lifts are up 71%, tummy tucks are up 94%, and of course, the most spectacularly, lower body lifts are up 4,386%, and upper arm lifts are up 4,159%. I checked the data out, and they do seem to be true. Similarly, in 2008, the top 5 procedures consisted of breast augmentation, nose reshaping, liposuction, eyelid surgery, and tummy tucks. Though the cosmetic surgery industry is not recession-proof, the total number of procedures performed in the US actually dropped by 12% in 2008. There can be no doubt that this industry has, in general terms, expanded exponentially over the course of the last 10 years. If the cosmetic surgery industry has expanded exponentially over the course of the last decade, then so too have public discourses about it and what it represents. Often contradictory, these discourses appear to be torn between embracing cosmetic surgery as a force of progress and development and rejecting it as a force of danger and destruction. Indeed, at some points, public discourses insist that cosmetic surgery does the work of magic and miracle in the lives of those who undergo it. Yet at other points, these discourses emphasize the risky and reckless aspects of cosmetic surgery, and in doing so, present it as a prime example of the problems with free market medicine. Similarly, in some instances, public discourses tell us that those who undergo cosmetic surgery will look better, feel better, and live better. In other instances, however, these same discourses warn us that those with poor self-esteem and low body image satisfaction may not benefit from cosmetic surgical procedures, and that the increasingly significant number of those who suffer from conditions such as body dysmorphic disorder may in fact be hindered rather than helped by them. The contradictions that characterize these public discourses indicate that we, as both individuals and collectives, are at the very least conflicted about our ever-expanding relationships to surgical technologies. Generally speaking, my research seeks to examine the experience of cosmetic surgery and how it is represented in the mainstream media. More particularly, my research explores the following questions as they relate to cosmetic surgery patients. How was their relationship to their bodies affected by the surgical procedures they underwent? How did their sense of themselves and their place in society change as a result of these procedures? How did they mentally integrate the changes made to their physical bodies? And to what extent did this integration succeed or fail? Which factors either enabled or disabled patients in their efforts to adjust to their surgically altered bodies? And finally, what do these experiences tell us about the dynamics of mind, body, and society as they relate to surgical technology? Now, if my research aims to understand how the experiences of cosmetic surgery are represented in the mainstream media, then it also aims to understand the representations themselves. To this end, I reflect on the following questions. Which procedures receive the most media attention? How does this attention function to at once normalize and pathologize such procedures? In what ways do media representations of surgical technology raise awareness about issues of body image and body modification, while at the very same time mythologizing and sensationalizing them? And finally, how do media representations both denounce the rise of surgical technology as a threat to the order of things and celebrate it as a triumph of the immortal, the invincible, and the transcendent? My research is informed by cutting-edge scholarship, no pun intended, from across the disciplines. It draws not only on communication studies and cultural studies, but on neurophysiology, philosophy, psychology, psychiatry, and sociology. In all of the scholarship that informs my research, body, self, and society are viewed as at once produced by and productive of one another, a theme that, as we will see, runs through all 3 of tonight's presentations. As a result, my research presupposes that when one alters the body, one alters the self, and by extension, society. Indeed, in an attempt to avoid treating the body as a set of spare and swappable parts, my theoretical framework presumes that changes brought to the human being's physical foundations are likely to bring changes to his or her psychosocial foundations. Though seemingly straightforward, many scholars contend that this presumption has yet to adequately inform present-day surgical protocols. My research situates itself here, then, and endeavors to show that the psychosocial is every bit as relevant to studying cosmetic surgery as the physical. The media representations I analyze are many and diverse. I look at web-based blogs, chat rooms and discussion groups, biographies and autobiographies, works of fiction and nonfiction, cable, talk, and reality television shows, and documentary and feature-length films. To analyze these representations, I use 2 methods. The first consists of a thematic analysis, while the second consists of a critical discourse analysis. Overall, my method allows me to consider how Westerners construct both their relationships to and their understandings of surgical technologies in and through the mainstream media. To discuss some of my preliminary findings, I draw on one of my case studies, the dramatic series Nip Tuck. Known for its edgy plot lines, its complex character development, and graphic operating scenes, the cable television show Nip Tuck is a meditation on both the pleasures and the pains of living in an age of surgery on demand. With record ratings and considerable critical acclaim to its credit, this quote-unquote disturbingly perfect dramatic series now informs many mainstream discourses on body image and body modification. In fact, given that its title is used in everyday parlance, its episodes are referenced in Hollywood's hit movies, and its subject matter preoccupies bloggers and chatters in internet forums around the world, Nip Tuck can be seen to play an important part in the production of public knowledge pertaining to cosmetic surgery. My research on Nip Tuck suggests that its representations of cosmetic surgery can be seen in a number of different ways. First, Nip Tuck can be understood as a metaphor for a wide range of fears, fantasies, and anxieties relating to surgical technologies. That is, on the one hand, Nip Tuck connects cosmetic surgery to achievement, affluence, beauty, desire, power, prestige, success, and of course, youth. In doing so, it can be seen to communicate what is by now a cliched constellation of far-reaching fantasies, fantasies that equate cosmetic surgery with self-actualization, self-governance, and self-sovereignty. On the other hand, however, Nip Tuck articulates cosmetic surgery in almost apocalyptic terms, or put slightly differently, in terms that link it with the end of the so-called natural body, and by extension, the collapse of the so-called natural order. With this in view, Nip Tuck's representations of cosmetic surgery can be seen as anything but straightforwardly celebratory. Instead, they can be seen, at least in my view, as confused, conflicted, and above all, ambivalent. If Nip Tuck's representations of cosmetic surgery are ambivalent, then they are also in some respects deeply ambiguous. That is, Nip Tuck is intriguing in as much as it encourages its viewers to complicate their understandings of cosmetic surgery. While the show does, of course, devote many of its episodes to procedures such as breast augmentations and facelifts, procedures that fit neatly and tidily into the category of cosmetic surgery, it devotes just as many of its episodes to procedures that evade or exceed this category. A small survey of the show's subject matter says it all. In its first 4 seasons, Nip Tuck addresses issues such as breast reconstruction, circumcision, cleft palates, clitoral reconstruction, combat injuries, conjoined twin separation, eye surgery, facial disfigurement, facial transplantation, hand disfigurement, labial reconstruction, leg extensions, morbid obesity, sex reassignment, and self-demand amputation. They're nothing if not ambitious. Indeed, Nip Tuck challenges its viewers to question conventional distinctions between cosmetic, reconstructive, and transplant surgeries, and in doing so, to assess and reassess why they consider some procedures curative and therapeutic, and others superficial and vain. My findings suggest that Nip Tuck functions not only as a metaphor for ambivalence and ambiguity, but as a pedagogy, or put slightly differently, as a lesson in life and living. My research partners and I call the show a biopedagogy, insofar as it instructs its viewers in how to manage their bios, or the life of their bodies. Like many other representations of cosmetic surgery, Nip Tuck portrays the individual, and the individual alone, as capable of and responsible for managing his or her health through a variety of market-driven options. In fact, in and through these portrayals, the individual is not only encouraged, but expected to take advantage of market-driven healthcare options for the purposes of perfecting the body's parts and processes. In other words, biopedagogies like Nip Tuck teach their viewers how to both maintain and sustain their bodies in an era of neoliberal economics. That is, how to watch them for signs of weathering and weaknesses, and by extension, how to rescue, rehabilitate, and save them when signs such as these are made manifest. Of course, Nip Tuck's biopedagogical strategies are effective, at least in part, because they are propelled by the forces of fear and panic. And insofar as they are propelled by these forces, the show can be seen as a cautionary tale that sets up a dichotomy between those who manage their bodies through free market healthcare options like cosmetic surgery and those who do not. My research suggests that if we want to understand the desire underlying the rise of cosmetic surgery and its increasingly important role in the making of male and female bodies, then we would do well to take media representations like nip tuck seriously. Though these representations are not infrequently outrageous, sometimes even exploitative, they are, as I hope I have shown, important ways of accessing the collective conscience. Indeed, both metaphor and pedagogy, present-day media representations of cosmetic surgery have a great deal to tell us about bodies, selves, and societies in the post-millennium. Thank you.